Thank you, Mr. Chairman. I also want to thank my good friend from Indiana for her leadership on this very important piece of legislation, as well as the chairman and ranking member of the committee for working together to bring it to the floor today. The United States is being ravaged by skyrocketing levels of prescription opioid and heroin abuse. This brutal epidemic has accounted for more than 28,000 American deaths in 2014, destroying families and devastating local communities alike. My constituents in western Pennsylvania have been particularly hard hit. In the past 2 decades, there has been a 470% increase in drug overdose deaths. The vast majority of these have been heroin and opioid related. 2 weeks ago, at a local hospital in my district, 5 overdose patients were treated in 1 day alone. In February, the same facility treated 20 overdoses in just 2 days. We need meaningful and evidence-based solutions to combat this scourge. I have worked to help develop those solutions as part of the bipartisan task force to combat the heroin epidemic and by holding roundtables with stakeholders in my district. I strongly believe that the legislation we are considering today is another step forward in that process by creating an interagency task force to review and update best practices for pain management and prescribing pain medication. As part of its work, the task force will consider various types of data and practices. For example, it must consider the existence and availability of different classes of opioids, including those with safety measures, such as abuse deterrent technology. And it must also consider how high-risk populations are managed by medical professionals. The legislation is entirely silent on the issue of naloxone, however, and thus the amendment that I offer with my friend from Massachusetts, Mr. Keating, simply seeks to have the task force take into consideration the practice of co-prescribing this life-saving drug as part of its work. Naloxone has the ability to revive a victim who has suffered an overdose within minutes. It is both safe and effective and has been used successfully to counteract more than 26,000 overdoses between 1996 and 2014. First responders who have seen what naloxone can do have referred to it as the miracle drug. And the American Medical Association and many community, state, and national groups have supported co-prescribing naloxone to patients who are taking opioids as a critical part of the solution to the rising epidemic of opioid overdose-related deaths. Considering the practice of co-prescribing naloxone, particularly for high-risk populations or when other avenues of treatment have been tried and failed, is an essential part of addressing the opioid and heroin epidemic. And by reviewing and updating best practices with respect to co-prescribing naloxone, the interagency task force can ensure that health professionals at all levels, both in and outside of government, are fully informed of this option when prescribing and treating patients. Simply put, Americans are struggling with opioid and heroin addiction cannot be treated if they lose their lives to a drug overdose. It's essential that we get naloxone into the hands of those who need it the most in a safe and effective manner. My amendment would ensure that the task force takes a close look at this. With that, I reserve.
The gentleman reserves.